Hello, everybody. My name is Tyler Segarra, and this is the second case study where we'll look at an operant extinction intervention. This study looks at an operant extinction intervention, which is an intervention to eliminate an undesirable behavior. The client description and the target behavior. Well, first off, we have a client who is a 6-year-old female diagnosed with ASD, receiving full intensive services of 37.5 hours a week at our clinic. The target behavior specifically for this case is the aggressive behavior that she would demonstrate when in a classroom, engaging in classroom activities such as parallel play or cooperative play, or even joint attending skills. The intervention goal for this intervention is to eliminate, the target behavior while increasing appropriate peer interactions during group time. Here are some assessments that we used. So first off, we always use a VB map assessment to find the skills and determine the verbal behavior skills of our client and to determine where they are developmentally. We do this by direct observation, as well as we find behaviors of concern or problem behaviors during direct observation, as well as during parent interviews and questionnaires. And then finally, after we do find problem behaviors that we are looking to decrease or eliminate, we use a functional behavior assessment to determine the function of the behavior, to determine what is maintaining this behavior and continuing to reinforce this behavior so that we can come up with a functional-based intervention plan. The outcome of the assessment was found that attention is the maintaining function of this behavior. That means that when the client engages in aggressive behaviors in a classroom, she is looking for attention, whether that is from the teacher or from peers. That is what we found when we ran the FBA on this behavior, and it was able to help us to come up with an intervention to address both the behavior and the socially mediated attention function. The intervention that we used was to offer a differential reinforcement of alternative behaviors, or DRA for short. This protocol was implemented specifically in the classroom, specifically for aggressive behaviors. And we would begin by reinforcing alternative behaviors to aggression. This could be raising hands to get teachers' attention or appropriately asking for help. We found that manipulating the environment to have her own seat that was farther away from the clients proved to be effective. We also found that being able to provide a punching bag was an effective way to get some of those aggressive behaviors to be a more functional behavior of hitting a punching bag when the client got a little overstimulated. And so we were able to pair using the punching bag and engaging in socially acceptable and appropriate ways to interact with peers as a way that we could begin to condition reinforcers such as attention and have her earn those reinforcers through those appropriate ways, and not earn that reinforcer if she was engaging in maladaptive behaviors. This intervention used stimulus control. Stimulus control was employed when we were able to contrive the environment to decrease and eliminate the client's aggression. We used the designated space in a punching bag, as well as gradually bringing the peers back to her, back so that she could slowly be faded into peer play again, to control the stimulus and be able to provide a chance for her to earn reinforcers rather than having unmediated access to these reinforcers. Overall, the intervention proved to be effective, and the client was able to interact appropriately. We began eventually to fade out the punching bag into fidget toys such as squishy balls or a stress ball in order for her to have an outlet if she was overstimulated in class, and she began to more functionally ask peers to play with her and get attention in a functional, appropriate manner.